Thank you, sir. Before we go to resolutions, I'd like to ask members of the Government Employees Committee to meet in the Speaker's conference room. Mr. Abate is about to make his way. Members of government employees in the Speaker's conference room.
Government employees, Speaker's conference room, Mr. Abate is awaiting you. Mr. Morelli.
Yes, sir. If we can now go to page 3 of the main calendar and begin our work with Resolution 1024 by Ms. Joyner. And I do note that on resolution numbers 1162 and 1197 that members have an interest in speaking on those two resolutions.
Clerk will read.
Resolution number 1024, Ms. Joyner. Legislative resolution calling upon the Centers for Disease Control and Prevention to develop a remedial action plan addressing the high incidence of asthma in children living in the borough of the Bronx in the city of New York.
On the resolution, all those in favor signify by saying aye. Opposed, no. Resolution is adopted.
Resolution number 1162, Mr. Ortiz. Legislative resolution memorializing Governor Andrew M. Cuomo to proclaim April 2016 as Organ and Tissue Donor Awareness Month in the state of New York in conjunction with the observance of National Donate Life Month.
Mr. Ortiz on the resolution.
Thank you, Mr. Speaker, and thank you, my colleagues. This is April is being recognized as an Organ Donations Awareness Month. As we all know, across the United States, on average, 40% of the people sign up for organ donation. But in New York State, 15% are registered, Mr. Speaker. They are registered to donate their organ. New York State had the lowest of donation in the country. The state has the third highest number of residents on the national waiting list waiting to receive an organ transplant. In practical terms, Mr. Speaker, this means that every year only about 1,200 people receive an organ transplant here in New York State. And over 10,000 people are continue to waiting on the waiting list for an organ transplant. In New York State, Mr. Speaker, and throughout the country, we are still facing a public health crisis in organ donation in the state. During the course of our work, several names will be added to the list of people waiting for organ donation. By the end of the day, another people will die because of life-saving, because we do not have enough people in the waiting list to donate their organs. Mr. Speaker, year after year since I've been in this chamber, we always trying to increase and to motivate this House to get involved in bringing awareness about why it's so critical and so important that we will be able to live a life and a precious life to someone else. We have passed legislation here mandating that we will be able to have DMV to accept those who are registering for a driver's license. We have done legislation to ensure that we can have the Department of Health and a registry to continue to reach out and people to make more accessible, more easier for people to register, to ensure that we'll be able to increase our number. Mr. Speaker, I would like to thank my colleagues, especially Assemblywoman Meyer and Aline Jaffe and Assemblyman Phil Parmesano for joining me today and for being so supportive and passionate about this issue. Every single one of them had their own story. like I have my own story, why I got involved in this issue. As many of you have heard my story year after year. But if I don't tell my story, probably my mother will pull my leg tonight from heaven. And I had to say to you that in 1980, when I came to this country, my mother suffered from failure kidneys. And both kidneys, was not only one. So make things a little more tight. So the 6 of my siblings, we submitted ourselves for testing. Lucky enough, my younger sister was qualified, was a perfect matching. And being a perfect matching, so give her, my mother, the best opportunity and the best chance. But having my sister those days at the age of 17, we was very concerned whether or not this was something that the older Ortizes would allow my sister to move forward. But in 1983, finally, we make the decision because my mother was in dialysis. For those of us who knows what dialysis means, it's what I call the silent killer. Being attached to a machine for the rest of your life, that is not how you would like to see a child at the age of 9 versus my mother at the age of 55. So we have a work to do. And I'm encouraging every single one of you to do exactly what my sister did. And we make a final decision that my sister will be fine after donating her kidney to my mother. After my sister donated the kidney, my mother had a better life. Was not anymore to see this machine in the house. No anymore to see her running to the dialysis room, midnight. No seeing her suffering anymore as a result of that particular decision that was made together by the family by allowing having my sister to move forward. We all have an obligation, for those of us who believe in giving somebody else a precious life, to bring awareness about this issue to the school system. And today, as I speak in here, my son is waiting also on the waiting list for a heart transplant. So, but this kid has been a fighter since the age of 6. Today, we're very happy to have him with us. We're still waiting very passionately. I don't know how long we have to wait for it, but we will continue to wait. And has been some suggestion, a defibrillator, as part of the game, of the equation, to make sure that he doesn't die. Mr. Speaker, I would like to thank you for this opportunity, and I hope that New York State will be able to change this number, and I will be remiss if I do not acknowledge counties like Erie County, St. Lawrence County, Canton County, Saratoga County, and Suffolk County, and other counties that have make this issue a front run in their county, and they have managed to increase the numbers in the last 2 weeks. So therefore, Mr. Speaker, I'm going to be voting in this resolution in the affirmative, and I hope, again, that we can remember ourselves, that we can give somebody a chance of life. Thank you.
Mr. Palmisano.
Thank you, Mr. Speaker. My colleagues, I too would first like to say thank you to the lead sponsor on this, Assemblyman Ortiz. You know, Mr. Speaker, my colleagues, every year we come to this chamber in April and pass this resolution to proclaim April as Organ and Tissue Donor Awareness Month. And it's been a privilege to work with Assemblyman Ortiz over the past several years on this issue. Prior to that, Jim Conti, prior to 2013, our former colleague Jim Conti, from 1992 to 2012, was one of the main advocates and prime sponsors on this resolution. I know Mr. Conti's family was here recently in Albany visiting, and you heard a lot of wonderful remarks about Mr. Conti. And for many of our newer members who didn't have the privilege to know Jim Conti, Jim was a 2-time kidney transplant recipient and a great human being. And he was a staunch and tireless advocate on the issue of organ donation. We lost Jim in October 2012, and although his passing left a hole in the heart of this chamber, his mission and his work still lives on in each and every one of us to help bring more organ donor awareness to the people of this state. And it's really incumbent upon each and every one of us to carry on this mission and message, because it literally saves lives. You know, when Jim talked about this issue, he always talked about with passion and facts, and just go over some of the facts, because the facts are important. First and foremost, medical technology is changing each and every day to help with the advancement, which is going to save more lives. But unfortunately, the waiting list continues to grow, especially here in New York. And what I would say to you, I know a number of our family members, people have been touched by personal stories. If you haven't, the only thing I could say is you never know when one of your loved ones might be in need of an organ transplant. So please keep that in mind as we move forward. But some of the facts in New York that jump out at me is that we have over 10,000 New Yorkers right now on a waiting list waiting for an organ transplant. 1,700 have been waiting for more than 5 years. There are 52 registries across our country. New York is number 51. 51 out of 52 registries. Mr. Speaker, my colleagues, that's just unacceptable. New York has the third highest need for organ donor recipients, but yet the second worst registry. New York's list makes up 10% of the national list. The national list is over 113,000 people. Some other staggering statistics that you should know about. The national average is 50%. The number of registered eligible people who could donate an organ is 50%. The state of Montana is number 1 at 89%. The state of New York, 26%. Mr. Speaker, my colleagues, that's unacceptable. Over 50% of those on the waiting list are minorities. In 2015, we lost 500 men, women, and children in New York waiting for an organ transplant. That's one person, one New Yorker every 15 hours. One person who signs up to be an organ donor at the time of their death, they can save up to 8 lives and impact the sight and vision and mobility of up to 50 others. Think about that statistic. One person at the time of their death can save up to 8 lives and affect up to 50 others. And we all have some personal stories. I know Mr. Ortiz spoke about a couple of our colleagues. You know, some former colleagues who are no longer serving here. Assemblyman Bill Hoyt. He died on this floor waiting for a heart transplant, and no one knew it to that day. And his son, former Assemblyman Sam Hoyt, continued work on that issue in his years in his chamber. Our former Assemblyman Richard Brodsky's daughter, Willie, received a kidney from his wife, and he's still a great proponent of organ donation. Our colleague Andy Goodell, his daughter, selflessly donated a kidney to a friend. And for me, Mr. Speaker, this story has always been very personal. My sister was a 2-time organ transplant recipient, first in 2000 from the kindness of a stranger, where she received a kidney pancreas transplant because her body was affected by juvenile diabetes. And then in 2006, I had the privilege to donate a kidney to my sister. And I saw firsthand how organ donation can impact the family and their life and their quality of life. And I never really talked about that issue until I talked to Jim Conti. He says, you have to talk about this story. We have to bring awareness to this issue. You know, we've taken a lot of positive steps over the past few years. First with the passage of Lawrence Law, which Assemblyman Ortiz talked about, how now when you do your driver's license, you have to answer whether you want to be an organ donor or not. In 2014, we passed legislation for a public-private partnership. Last year, we passed an amendment to Lawrence Law, and since that amendment went into effect, organ donation registrations have increased 70% at the DMV. People answering, yes, I want to be an organ donor. And even in this year's budget, we have appropriated $1 million to help with the issue of organ donation and tissue awareness. But you know what? We can do more. We can do better. We have to improve this registry. You might be asking, what can I do? Well, 1, register to be an organ donor yourself. 2, use your office to promote organ donation and awareness. Use social media, Facebook, Twitter. Post links on your Facebook page. Send notices to the media. Earlier today, Assemblyman Ortiz and I circulated memos to each and every one of your offices with press packets, social media information, bracelets, flags, pins, things that we can continue to talk about. Because there's so much more we can do to change the numbers. You know, Mr. Speaker, my colleagues, we passed a lot of bills in this House. Some are good, some are not so good. But this issue is not necessarily about money or legislation. It's about promoting awareness. And this is something that actually saves lives. But it does require a commitment on our part to take action. So we're asking each and every one of you, use your offices, use your bully pulpit, use your media to talk about this issue. Because, as I said before, you know, when you have a personal connection to this, it affects you. But right now, you don't know if one of your loved ones is ever going to need a life-saving transplant, organ transplant. And if you do, you don't want to be in New York State being numbered the 51 out of 52 registries or 10,000 New Yorkers on the waiting list. We can do better. And I'd be remiss if I didn't go back to our former colleague, Jim Conti. You know, as an individual, no one did more for this issue as an individual than Jim Conti did. But collectively as a body, we can do so much more to bring awareness and education into our communities across the state. And that's what Jim would want us to do. That's what our loved ones would want us to do. So let's just not just pass this resolution and go on to the next thing. Let's think of how we can go back into our communities and promote awareness and education, look at new ideas and legislation, and getting that awareness and education out there, because this is about saving lives. So, Mr. Speaker, my colleagues, thank you for allowing me to speak on this important resolution. It's so important, and I thank all of you for your attention and your action, and I will be voting in the affirmative. Thank you, Mr. Speaker.
Thank you, sir. Ms. Mayor.
Thank you, Mr. Speaker. I rarely speak on resolutions and combine the personal and the policy, but in this one, I think it's imperative that I do so. In the last week, my husband and I suffered a terrible loss of his brother in the prime of his life in California. And to his credit, he had signed up as an organ and tissue donor. And in the course of great sadness of losing him, we were committed to honoring his desire and his memory by ensuring that we did everything to fulfill his wishes that other people would be able to live as a result of his death. And so in the end of last week, we were able to save 3 lives by the death of my brother-in-law, by his commitment to be a donor, and it's a personal reminder to all of us. We do not know when we'll pass. We do not know the circumstances of each other's life and death. But we can do something to keep someone else alive in the course of life, and that is by becoming a donor. And I'm so pleased that the sponsors have made this resolution and kept this issue alive, because as my brother-in-law shows, through death there can be life, and through that we honor his memory. Thank you.
Thank you, Ms. Meyer. Mr. Lupinacci.
I rise also to speak on the resolution. My predecessor, Assemblyman Jim Conti, was a 2-time kidney recipient, as was discussed by some of my colleagues. And Jim led the charge as one of the Assembly's leading advocates for organ donation. And just to recap again, some of the things that he did accomplish while in the Assembly dealing with organ donation, well, he established the Gift of Life Trust Fund and the statewide donor registry. And his memory and courage have inspired me to work closely with groups such as the Long Island Trio, Live on New York, and Stony Brook University Transplant Outreach, and to continue to champion their cause not only on Long Island, but also up here in Albany. And when we look at the grave statistics that were mentioned, just to recap them, New Yorkers are literally dying while waiting online for an organ. New York State ranks dead last in organ donation registration, with 22% of adults registered, and that's nearly 20% less than the national average. New York is also the 3rd highest need for organ donors, making up at least 10% of the national waiting list, with 10,000 that are in need of an organ today. Organ donation and transplant education needs to continue, and we need to make sure we work on it. And it starts with just knowing the basics, knowing how to go about and how to register. And today, New Yorkers continue to face a grave truth. While every 15 minutes a New Yorker dies while waiting for an organ. While we continue to make progress nationally and statewide, we still need to do much more. This has to change, and it starts with education. If we start to educate students at a younger age and continue to promote it within the health curriculum, they realize it's easy as just checking yes. Through encouraging conversation about organ donation and transplants, we could spread the word about this life-saving effects that donors have and what true donors and heroes the donors really are. So we need to make sure that we continue to work on this, and every time we see a donor license plate, that was created, Assemblyman Conti created those also. And we need to make sure that we continue to work hard. And since we do rank dead last, 50 out of 50, and when we add in Puerto Rico, we continue to go down to number 51, we need to make sure that we continue to do more so we continue to rise on the list and get out of the dead last center. So thank you, Mr. Speaker.
Thank you, sir. Ms. Peoples-Stokes.
Thank you, Mr. Speaker. It puzzles me as a citizen in the great state, Empire State of New York, how we can be last in donor sharing. We have some of the most philanthropic people in the whole world in the state of New York. And to think that folks are not willing to, at least on their license, say, I will be willing to donate my organs, is a little unnerving to me, because I just find that hard to believe. Now, I've heard that literally every year since I've been here. I want to commend the sponsors, Mr. Ortiz and Mr. Palmisano, for introducing this resolution. And I hear this every year, and it just doesn't seem to change. And so, as a person who is the mother of someone who was one of those thousands waiting for an organ donation, I just want to share this. I was sitting in the caucus meeting this morning or this afternoon, and up on the wall I read a little sign that really struck me so well that I actually tweeted it out. And I want to say it today because I think it means a lot, because it's not just about each day, but it's even about after the day when you're not here anymore. It says, give yourself back to the world each day. And I just think that's a quote that we need to put out there, that we should not only be giving ourselves back to the world every day in what we do in our everyday lives and whatever our work may be, but we should think about giving ourselves back to the world when we're not here as well. Thank you, Mr. Speaker.
Thank you, Ms. Peoples-Stokes. On the resolution, all those in favor signify by saying aye. Aye. Opposed, no. The resolution is adopted.
Resolution number 1193, Mr. Morelli. Legislative resolution memorializing Governor Andrew M. Cuomo to proclaim April 19, 2016 as Day of Congenital Diaphragmatic Hernia Awareness in New York State.
On the resolution, all those in favor signify by saying aye. Opposed, no. The resolution is adopted. Mr. Morelli.
Yes, pardon the interruption, Mr. Speaker, while we're doing resolutions, but I'd like to ask members of the Social Services Committee to meet in the Speaker's conference room. I see Mr. Hevesy is about to make his way. Members of Social Services in the Speaker's conference room.
Social Services Speaker's Conference Room.
Resolution number 1194, Mr. Abenante. Legislative resolution memorializing Governor Andrew M. Cuomo to proclaim April 14, 2016 as Library Assistance Day in the state of New York.
On the resolution, all those in favor signify by saying aye. Aye. Opposed, no. The resolution is adopted.
Resolution number 1195, Mrs. Barrett. Legislative resolution recognizing April 10th through the 16th, 2016 as National Library Week.
On the resolution, all those in favor signify by saying aye. Opposed, no. The resolution is adopted.
Resolution number 1196, Mr. Titone. Legislative resolution memorializing Governor Andrew M. Cuomo to recognize April 15th, 2016 as a day of silence in the state of New York.
On the resolution, all those in favor signify by saying aye. Opposed, no. The resolution is adopted.
Resolution number 1197, Ms. Titus, legislative resolution memorializing Governor Andrew M. Cuomo to proclaim April 12, 2016 as Equal Pay Day in the state of New York.
Ms. Simotis on the resolution.
Thank you, Mr. Speaker. I rise to speak on the resolution before us recognizing April 12, 2016 as Equal Pay Day in New York State, symbolizing how far into 2016 women must work to catch up to men's earnings from 2015. That's an additional 102 days the average woman must work to receive the income the average man received last year. Although April 12th is designated as Equal Pay Day based on average national statistics, when we break down wage gap data by race, we find that many women are even further away from reaching pay equity. For example, African American women who are still paid 64 cents on the dollar must work nearly 19 months to earn the pay average white man received last year. Native American women earn 59 cents on the dollar and will not experience equal pay day until September. The wage gap is widest for Latino women at 55 cents on the dollar, meaning it will take them until October for them to catch up to white men earnings from last year. Pay disparities are further exacerbated by factors of disability, sexual orientation, and gender identity. It is critical that we work to combat intersecting forms of discrimination and ensure that all women, regardless of their background, are able to earn fair and equitable wages. The wage gap persists across all fields and educational levels. Over the course of her career, the wage gap costs the average woman between $700,000 and $2 million, contributing to high rates of economic insecurity, especially among elderly women. Equal pay is vital to the well-being of working women, to the families they support, and to the communities they belong to. On Equal Pay Day, it is imperative that we recommit ourselves to gender equality and continue to work to end wage gap for all working women. Mr. Speaker and colleagues, I thank you for the opportunity to be heard on this resolution and encourage you all to support it. Thank you.
On the resolution, all those in favor signify by saying aye. Opposed, no. The resolution is adopted. Mr. Morelli.
Yes, thank you, Mr. Speaker. If we could begin on page 46 of the main calendar, beginning with calendar number 480 by Mr. Simbrowitz.
Clerk will read.
Assembly 1358, calendar number 480, Mr. Simbrowitz, an act to amend the insurance law.
The bill is laid aside.
Assembly 1646, calendar 481, Ms. Rosenthal, an act to amend the general business law.
The bill is laid aside.
Assembly 1690, calendar 482, Mr. O'Donnell, an act to amend the correction law.
The bill is laid aside.
Assembly 4409A, calendar 483, has been amended. Assembly 5471A, calendar 484, Mr. Gottfried, an act to amend the penal law.
The bill is laid aside.
Assembly 7552, calendar 485, Mr. Brennan, an act to amend the civil practice law and rules.
Read the last section.
This act shall take effect January 1st.
Clerk will record the vote. Mr. Morelli.
Yes, sir. This is our first vote of the day, colleagues, so please cast your votes. And those who can hear our voices but are not in the chambers, please make your way in so you can cast your first vote of the day.
Are there any other votes? Announce the results.
Ayes 106, noes 0.
The bill passed.
Assembly 8116B, Calendar 486, Mr. Perry, an act to allow certain entities to convert their status of filing as a not-for-profit organization to a for-profit entity.
The bill is laid aside.
Assembly 8650A.
Mr. Morelli.
Thank you, Ms. Speaker. I'd like to just interrupt to let members of the Codes Committee know that they should move to the Speaker's Conference Room. Chair Lenthal is ready for codes in the Speaker's Conference Room.
Members of the Code Committee, please go to the Speaker's Conference Room.
Assembly 8650A, Calendar 487, Ms. Paulin, an act to amend the public health law.
The bill is laid aside.
Assembly 9356, Calendar 488, Mr. Cusick, an act to amend the public health law.
Read the last section.
This act shall take effect immediately.
Clerk will record the vote.